We are looking at financing cervical cancer elimination. That is the compounding issue of all interventions that are aimed at ensuring that we eliminate the cancer, but also manage it. And of course, investment actions to end the debilitating condition. I have two very important guests who will be helping us understand what is at play, also the facts and the prevalence of the disease. But let me first go through the preamble. Cancer of the cervix is the most common among women worldwide. It's estimated that the prevalence of human papillomavirus, HPV, infection among the general population in East Africa is at 33% compared to 11% worldwide. In Uganda, cancer of the cervix accounts for 80% of all female cancer cases and 40% in the Kampala Registry, clearly calling for more action to end this dire challenge. To help us with a perspective, I have Alvin Muhwezi, the head of programs at InPact, as well as Lynda Birungi, a medical service provider at Reproductive Health Uganda. A very warm welcome, lady and gentlemen.
Thank you.
Reading the preamble, it shocks the conscience. It takes me back to understand that 7,000 cases of cervical cancer registered every year. But what is more shocking is that 5,000 people are dying every year. This information is not good. What is the state of affairs on top of these very grim statistics?
Thank you very much. What makes that statistic even grimmer is when you look at the overall population of Ugandans within the age bracket that is prone to cervical cancer. We have about 13 million Ugandans above 15 years and above. And so when you put that into that perspective and look at what you've just mentioned, the annual cervical cancer cases and death rates, it projects a very grim future in terms of the danger or damage that cervical cancer can cause. So to answer your question briefly is to say yes, the outlook is very concerning. We have a very high mortality rate for cervical cancer. The positive is that it can be prevented. And it can also be managed early. If screened for early, it can be managed early. So there is at least an opportunity to save as many people. One, from protecting them entirely from getting the cervical cancer, but also screening, and in the event that one has it, detect it early and manage it early. And those cases that have survived the cancer are overwhelmingly those who have been going for routine screening, caught the cancer early, and gotten onto treatment and managed it quickly. Okay,
understanding the drivers of this particular cancer is very important in eliminating it. Before I come to Lynda Birungi, who is of course buried into many of these dynamics at reproductive health, is it right or even reasonable to ask the question, what brings about this particular sort of cancer?
Yes, cervical cancer is caused by the human papillomavirus. This is a virus that is sexually transmitted. Men are predominantly the carriers, although it can also affect them, but not causing cancer. For men, it's mostly it causes genital warts. But for women, because of the fact that they are blessed with the cervix, means that the cancer, that's why it's called cervical cancer, presents in women that way. They can also get the warts, but the biggest risk for them is the cancer. That's why when we go to the prevention side, in Uganda we advocate for and are providing the human papillomavirus vaccine, HPV vaccine, which is administered in 2 doses. Over a period of 6 months, so first dose and second dose. And this vaccine is administered to girls ages 12, but the primary driver is, there's a window 10, 12, 13. But the primary premise is that girl should not have been sexually active by the time she gets the vaccine.
Okay.
So you might find a 15-year-old who has not yet been sexually active, and they'll be eligible. Even an 18.
Okay.
And so there is that's the prevention side. Get your 2 doses. If you're not sexually active, you're covered for life. You will not get the cancer. Now, for those who are sexually active, then the solution is routine screening.
Routine screening
for the cervical cancer,
okay.
which Lynda will expound.
Of course, and that brings me to Lynda Birungi, a medical service provider at Reproductive Health Uganda. Reproductive Health, to my understanding, deal with the rollout of information to people, including the youngsters, the women. When he says that you should, by the time you take the vaccine, you should not be have been rather sexually active. This is down to people understanding and knowing that within your rollout of information, how effective is this working? You could also bring us up to speed with your particular work with regard to this.
One, like he said, it's recommended that if you're to get that vaccine, you should not have engaged into sexual intercourse.
That's right.
Reasons are when you engage into cervical, you engage into sexual intercourse, you pre-expose yourself. 2, young girls who are actually engaging into sexual intercourse, sometimes their organs are not fully grown, and before you know it, it's easy for the HPV virus to penetrate. So if you get the vaccine and maybe the virus is already there, remember it takes a longer time as it progresses.
That's right.
Someone can even get it and you can only detect it maybe after 5, 10 or so many years. So, but before that, I think we also need to understand what are those other factors that may expose us more. Like he said, sexual intercourse, but more especially young girls who are actually having sex when it's quite early. 2, multiple sexual partners. You have many partners, you're changing here and there, or sometimes you actually have several partners within the same period of time. For young girls who are actually sexually active, but also conceive when they are still younger. Remember I said the organs are still, teenage pregnancies. But 1, they are into sex early, maybe they have multiple partners, but also the organs are not fully grown. So anything that adds pressure or distorts the proper growth of this particular organ will do what? Will expose this young girl into having a cervical cancer virus, which is the HPV virus, that will expose her and maybe her future years after teenage age may not be the best. Another thing I also want to talk about is those young girls who actually start engaging into sexual intercourse. We've been having a challenge of teenage pregnancies. Between me and you, we know talking abortions are restricted or illegal, but believe me or not, there are people who are actually doing it, and doing it unsafely. And how often are you going to do this? It also exposes you the most. So anything that puts...
So essentially having an abortion exposes you to,
especially for young girls whose organs, whose uterus is still developing and growing, still not fully grown. So it exposes them. So some of these things, why am I talking about them? We need to start preparing our children when it's still, and even before we actually take them for the vaccine. Who are the people around our children? What are they actually doing with our children?
Wow. The challenges are...
It's not about even having sex, but what environment is around them. Are we exposing them? Are we, you get my point? So at the end of the day, what are we doing as the guardians, the parents, the teachers, and everyone around these growing up children? Are we protecting them? Are we giving them information to help them understand that it's for their own health?
Okay.
Yes.
Talking about the young population, understanding what is at stake. Mr. Muhwezi spoke about the fact that the HPV is widely spread by men. Did I get that
Yes.
right?
Yes,
Through
carriers, yes.
they are carriers, but through sexual, it's contracted through sexual intercourse.
With the men,
right.
yes.
So that means when you are rolling out immunization campaigns, men or young boys ought to be part of the equation.
Male involvement.
Male involvement. How is it going? Because when it comes to dealing with men, there's always that reservedness, and sometimes total men don't want to associate with certain things, and because they think everything shall be taken care of when the woman is examined, and then I'll also understand where I am.
So there are two ways to dissect that question. The first way is we get asked, isn't there a vaccine for men?
In fact,
So let me start with
I
that
thought
one.
I was going to sound dumb, but is there a vaccine for men?
So it's at different stages. There are countries like Australia that are really at advanced stages. I think they haven't started vaccinating boys. But in Uganda, and mostly in line with the Ministry of Health and World Health Organization guidelines, we are not yet there. We will get there inevitably, but
That's
we
right.
are not yet there. So to answer that question briefly, not yet would be the answer, but it is a possibility. That vaccines for boys will be available. Men involvement, so one of the best ways to target girls or reach girls for vaccination is through schools.
Yes.
So schools, primary schools and maybe secondary schools have a high volume of students that can be reached through vaccination campaigns. And that is what a lot of civil society is working with the Ministry of Health to do. Reproductive Health Uganda, InPact, we are actively supporting Ministry of Health, organizing health camps in schools to get girls vaccinated.
That's right.
And also at community level, of course. Cervical cancer screening is widely available. It can be done even right now on the premises with the right professional. So we do what we call community outreaches, where we're going to communities and screen for cervical cancer. So the access to preventive care is there, and it's readily available. And for men, going back to the girls, it's involvement, one, in sensitization, to know that they are key contributors to spreading of this cancer. Through their sexual practices, and so they have to be equally as cautious as the girls. But two, these are underage girls, so consent is essential.
Yeah, very essential.
So we need to involve the parents, the fathers, the mothers, but most the fathers, because in most of these homes, the fathers are the primary decision makers. So the male involvement goes through the sensitization and also consent and understanding the benefits of screening, but also prevention.
Okay.
Maybe I would like to add on what he said. It's more of preventive measures. I'll give you a few things we do, like at RHU. Apart from the community or outreaches, when we screen, we encourage everyone to screen, encouraging mothers, schools, and so on to take for vaccines. We also have other innovations, like everyone who works in the clinic, we talk about cervical cancer.
It doesn't really matter what they are there for.
It doesn't matter, because giving the information is the most important thing. We talk about cervical cancer. Anyone who comes in, for as long as she's within the age bracket of screening, we talk about cervical cancer. One, even if she doesn't take up the service at that particular time, she will go.
She's armed with information.
She's armed with information, or she will encourage another person to come.
That's right.
But then also, to be a little more particular for those who come in for family planning, we encourage them as they take up a family planning method. You can also screen, especially those who opt for IUD. You would be shooting two stones. I mean, shooting one bird with one stone. So we encourage them, please screen. Sometimes they are a bit hesitant, but when you labor to explain to them, they end up understanding. And it's also another preventive measure. And still at RHU, we have screen and treat.
Okay.
So when you come, you screen, we detect, and we can treat there and then with different methods. We treat you other than asking you to refer you or to go somewhere else where you might not even go. So at RHU, we also have screen and treat. We screen you immediately and we treat you instantly. You get the treatment immediately, which treatment is a single dose, and review is after 6 weeks. Okay. So those are all preventive measures to prevent the HPV virus to spread.
All right, now let's draw our attention to the particulars of financing cervical cancer elimination. The architecture that is existing right now means that healthcare is expensive for the average Ugandan. And when you speak about the fact that screening is undertaken, and then within the next 6 months, there's a lot of, you know, interventions on your part, the cost is enormous. It could be to the end user who are these victims, but most is borne by the funders. It could be government, it could be private sector players, including RHU. Before we go into the investment actions that are available, being undertaken right now, what is the cost of cervical cancer in terms of the public health care burdens, but also to the individual? If somebody is diagnosed with the HPV, how do they begin the journey for treatment? That could also be something that offers a lot more information and eliminates the fear. Because there are some of us, when we know the cost of treatment, we begin to tell ourselves, you know? So how is that? Anyway, we can begin with you.
Is actually, depending on the stages, the cost is not worrying. First and foremost, I would say screening for cervical cancer is really cheap.
Oh.
Cheap.
How much?
At RHU, we charge 20,000 to screen. But nevertheless, like for example, when we go to the communities, we screen for free. And even if we realize you are maybe
constrained,
not constrained, yeah, okay, yes, sometimes if you can't afford, there are certain things we won't allow you walk away without a service. If you come in for family planning and you don't have money, trust me, you will be worked on. If you come in for cervical cancer and you don't have money, we will find a way of helping you. Because it's more expensive when it has come up and it has grown to manage than doing it here. And even the treatment itself, if it's early, for example, if we detect you have HPV virus that might become a problem in future,
that's right,
we only charge 30,000. We only charge 30,000. Actually, usually when those days when we had projects, we would even treat for free, and even give you the drugs that accompany for free. Okay. So I would say on average maybe 50,000, which may still be a lot of money for someone out there, but it's not as compared the pain you will go through, the transport you will incur, when you do not know, when you do not access the service on time. The earlier you sort it, the better.
If somebody were to survive cervical cancer, what kind of treatment is available and what time frame does that treatment take for it to be, for one to be done with it? And that's where the real cost is anyway, when it comes to the financial aspects of treatment.
Okay, allow me to first take you back a little bit and talk about cervical cancer financing at national level. We are doing well in terms of gradually growing the budget allocation for immunization and vaccination in this country. The challenge, though, is that it is still overwhelmingly donor funded. Government of Uganda is contributing the smaller percentage of immunization financing in this country. It's heavily donor reliant. So what we are doing at InPact in partnership with other civil society organizations led by PATH is we are engaging through the process of budget reallocation and resource reallocation at national level. So we have ministry, the parliament, the legislature, whom we are engaging through the different parliamentary forums on immunization, being one of them, to at least allocate more resources to go towards immunization financing. The advantage that comes out of that would be, for example, decentralizing care and treatment for cervical cancer. Right now, I think you get stories every day of how the Cancer Institute is full. You'll find that a significant number of the patients there are cervical cancer patients. But imagine if we decentralized even what the services currently being provided at the Cancer Institute to the regional hospitals, for example. That would be convenient for a lot of patients. And that would probably bring down the cost of treatment. Imagine if you're coming from Arua to the Cancer Institute and you have to rent in Kampala, and of course you're not alone, you have a carer. All those costs can be prohibitive. And cancer, as it advances, the costs of managing it become high. So that touches on the question. Now, on terms of on-the-ground treatment and care, again, early screening helps. So the 50,000 she's talking about is if you are able to catch it early. But if someone comes and say they're at stage 4,
you can't
then you're going into palliative care, pain management and all that, and those are not cheap options at all. So what we are really pushing for is, can we prioritize allocating more resources for screening so that we catch it early, and for immunization so that we prevent it. And so we've been engaging the legislature, stakeholders to have a bigger percentage of the national budget committed to this.
Okay.
Yes.
We would have loved to know the extent of that particular engagement, but of course that would again take us into the modalities of legislation and policy formulation, which I don't want to. Let's keep it to matters that we are well in a position to comment on. Now, when it comes to financing within the urban or more well-established communities, it could be manageable, but the persons in the rural areas, it completely flips the public healthcare, a strategy, because they are suffering. Many of them might actually not know. There are those who claim they are jinxed by some stuff, and it's not actually cancer. Somebody conveniently says, me, I'm jinxed by somebody else, and that is also blocking their ability to quickly deal with this. You are dealing with information and teaching on how people should be able to adopt and understand these ailments and conditions. How are we succeeding?
To a degree, yes, though a lot needs to be done. One, I'll give you an example. At RHU, we have about 19 branches, but every branch has all the medical team there is well equipped with enough information and skills on how to handle this particular challenge of cervical cancer. So depending on where you are, we spread, we do outreaches. Sometimes we just use opportunities like this one, go on radio programs, TV programs. In the communities are mobilized to just give information and encourage people, mothers, girls. Even in schools, we do school outreaches where we just go and give information to them to encourage them to do all the preventive measures and have the first-hand information.
Okay.
Yes, please.
All right. I'm afraid we are out of time, but I am very convinced that the information shared will help in shaping opinion, but most importantly, helping those who could be grappling with cervical cancer to be able to deal with it, those who are not, to prevent it. Alvin Muhwezi, Head of Programs at InPact, many thanks for joining us, and many thanks to you too. Lynda Birungi, a medical service provider at Reproductive